I can. Welcome, everybody, to our first virtual Good Morning Seminole. My name's Jason Broder. I'm the president and CEO of the Seminole County Chamber, and I want to thank you all for joining us this morning. Before we get started with our program, I want to thank our sponsors. At this time, I'd like to give thanks to our gold sponsor, Mid-Florida Credit Union, as this event would not be possible without them. They were unable to join us this morning, but we greatly appreciate their partnership. We also want to thank our silver sponsor, Next Horizon. It's a game-changing time for businesses, as we know, and we're forced to quickly revamp product and service offerings. We're pivoting to online transactions and ensuring our employees are empowered to work without coming to a physical location. As you focus on the new opportunities for your business in this new reality, Next Horizon is here to put technology to work for you. So Rebecca will play this short video on behalf of Next Horizon. Excellent. Thank you, Rebecca. I'm glad the technology works. You do stuff like this, and sometimes you get a little nervous about how that goes. But thank you again, Next Horizon. We also have some additional valued sponsors for this event, Waste Pro, the Orlando Law Group, and Highland. Thank you for supporting this wonderful programming. And so as a bit of housekeeping and as a reminder, please stay on mute unless you have a question at the end. Feel free to ask any questions in the chat box. For those of you who are new to Zoom, right in the direct center of the bottom of your box is a little icon that says chat. If you hit that, a chat room will go out to the right. You'll see everybody's kind of been saying hi and good morning this morning in the chat room. And so we'll do our best to get to those questions at the end. The format for this morning is that as one of our speakers will begin, we have 6 of them this morning. Each will have about 5 minutes to share. That's 30 minutes of programming. And then we'll have about 30 minutes worth of questions as folks have issues that they'd like to get addressed by our healthcare professionals this morning. And so to make it easier to see, I would encourage you to change your view to speaker view. Most of you are probably in gallery view, so you see all of our smiling faces there. On the top right, if you click on the speaker view icon, it comes up to a gallery view, a speaker view, and that then turns on the view of the person speaking, and you won't have so much clutter on your screen. So with that, this morning, I would like to introduce our panelists. This morning, we have Shawn Molsberger, who's president of South Seminole Hospital, senior vice president. With him is Dr. Edgar Sanchez, the infectious disease physician, one of them at the Orlando Health Longwood. We have Tim Cook, CEO of AdventHealth at Altamonte. Along with him is Dr. David Sinclair, the chief medical officer of Altamonte. And then from our HCA partners, we have Trey, Abshier, CEO of Central Florida Regional Hospital, as well as Casey Donahey, who's the CEO of Oviedo Medical Center. So with that, I don't know if there's any order in which everyone would like to go, but we'll start with how about the folks from Orlando Health, South Seminole, if we want to have Dr. Sinclair and Shawn Molsberger start. You both have a combined 10 minutes, and so we'll go with 5 each for you, and we will turn the program over to you all.
All right. Hey, good morning, everybody, and welcome. Thanks, Jason. Thanks, Jessica. Thanks for putting this together and really just continuing business, as normal as possible. I really do hope everybody out there is doing well, adjusting to this new norm. We have 3, teenagers at home, and so it is a different norm, to say the least. It took all of, I think, 2 days for our kids to admit that they missed school and they want to go back to school. So I want to thank all the teachers in the school district, Seminole County Public Schools. You guys are amazing. And what you're able to do in such a short amount of time. So just a big thank you to everybody there. What I would say is that from an administrative hospital standpoint, I really want Dr. Sanchez to do a lot of the talking, because, you talk about someone on the front lines. He was on the front lines, not just here, but he works at all of our other campuses, from ORMC to Dr. Phillips to you name it. But here, and I think everybody will kind of have around the same comments, but I would classify as us having about 3 phases. The first phase was, we're just not sure what's coming. You had all these news reports, you talked to your colleagues, you obviously followed this not just nationally, but really internationally. And you just weren't sure. This was something that was new, and we were all learning around the same time. And so that was that first phase. And so with it became, hey, you got to get prepared. You got to continue to take care of the patients within your community at the same time as being prepared. So obviously more conference calls than I think any of us have ever been on our entire lives, but it was a lot of coordination. It was making sure that we had things in place with the things that we knew at that time in terms of ensuring that we had the appropriate protective equipment, things like that, of just making sure that, again, in consultation with all of our physicians to make sure that we were all on the same page. So again, when you got 22,000 team members, trying to get everybody on the same page and prepare for that, that was the biggest thing. So the second phase was really kind of going through it. And we did actually our own Orlando Health, we used our strategic planning department, and we developed our own model and basically utilized the other models from across the country and even internationally, and basically kind of put it in our data of the 4 counties that we look at on a day-to-day basis anyway. And we had a high, medium, and low. And so we really never even went above the low when you looked at where our campuses are. We reached our peak on April 8th, give or take. And ever since that time, it has been a decline. And we're obviously at our lowest level right now, and we've seen that. Do we see people that come into our emergency rooms every day with what we classify as a person under an investigation? Yes, we do. And a lot at our freestanding and even just our main campus here. And then a lot of those really do, the majority turn out to be negative, that they have those symptoms and they want that clarification. So the second phase was kind of going through it. As we started to get those patients, making sure our teams were ready, making sure we were following all of our protocols. And again, the nurses reminded me early on, Shawn, we've got this. We've taken care of infectious patients our entire career. They did an amazing job, all of our teams. And then the third phase is kind of where we're at now, and that is, how can we help educate the community, the business community, our families, our friends, the folks we go to church with, that it is okay and it's safe to go to the hospital to seek your care. We are talking to people every day, and we have throughout this, and it kind of breaks your heart because you feel like you need to do more from a communication standpoint, letting them know, hey, if you're having chest pain, you need to go to the ER. Hey, if you have this particular symptom, you need to go to the doctor. Things like that. You need to continue to get your care. And so we're working on that, and we've actually created our own website. Went live last week. It's orlandohealth.com/business ready. And basically, we took the best practices from really, we have so many physician specialists that have worked at the CDC, worked other places, went through this. And our goal is really to share the content directly from the experts on a daily basis to our businesses. So that is out there. It has presentations, you name it, videos on how to appropriately safely social distance. We had a lot of questions about how do you don and doff, how do you put on and take off a mask appropriately. So all of those things are there. So it's orlandohealth.com/business ready. And if you have any questions, feel free to reach out to myself or Megan Almasi or anybody else. So at this time, Jason and Jessica, I'm going to turn it over to Dr. Sanchez. We're going to switch spots real quick and let you guys hear from an infectious disease physician. And again, he is an amazing individual. So.
Hi, thank you so much for having me. My name is Dr. Edgar Sanchez. I'm one of the Orlando Health infectious disease physicians. Again, I just wanted to thank everybody, including the community, because it's been a hard couple months for us in the front line, but when we go out in the community, we see the support and love from everybody there. It really does make a difference for people like me and the nurses and the other medical staff. Yeah, so as Shawn says, while South Seminole Hospital is my main campus, I do rotate throughout all the Orlando Health systems, including South Lake and Claremont, Dr. Phillips, Orlando Regional Medical Center. So I've seen multiple institutions, and I have to say that I've been very impressed with the way all the medical staff, administration, from the nurses to doctors to environmental services, everybody in the hospital, how they responded to this really serious situation. Everybody's been working as a team, and it's really provided a safe, efficient environment. One of the things I say is that us doctors, we normally operate on recommendations and management of patients based on evidence. Years of clinical trials, studies, and such. And with a pandemic like this, or for a disease that didn't even exist 4 months ago, a lot of the recommendation information that we've had to implement, we've had to adjust based on new information, and which is the way that the institution has responded to that has been pretty amazing. The way the staff has remained flexible and working as a team. As a frontline individual, seeing a multitude of these patients, I've seen everything from those patients with mild to moderate disease that we are hospitalized for 1 to 2 days and recover at home, to the really critically ill in the ICU. And I really have to stress that through all my interactions with these patients, I've always felt safe. The hospital has implemented these policies that's kept us safe, and also from the fortune of us being in a Central Florida, of not having that huge surge we're seeing in other parts of the country, we've managed to have enough equipment to treat our patients and to keep our staff safe, enough ventilators, medications, as well as personal protective equipment. So throughout this entire ordeal, our whole institution I've always felt safe in our institution, in our hospital. And again, I wanted to stress what Shawn said. One of my big concerns now is that I see this with my own patients, of people being afraid to go to the hospital to catch COVID. So when they have illnesses that they normally would have gone to the hospital for, whether it be a worsening wound or chest pain or shortness of breath, they're waiting to get care and to come to the hospital. Now, yes, 75,000 people have died in this country from this disease, but around the same amount died of heart disease last year, and 140,000 died of stroke, and those diseases didn't go away. And so a lot of these diseases, we can intervene if you come to the hospital early. And and so I just hope that people out there in the community know that our hospital is safe, and please come to the hospital if you have any of these symptoms that warrant this. And so again, thank you for having me, and I'll be here to answer any questions about anything that you may have about for the people on the front line. Thank you.
Well, thank you, Shawn, and thank you, Dr. Sanchez, for that. And it's one of the things that we noticed was that as this was going on from a management standpoint, folks did seem to not want to go get routine medical care. And people should understand that if you need medical care, you should go to the hospital. It is the environment in which you need to be. And so with that, we want to make sure we spread the word that we're managing this in a way that makes it safe for folks, just like it would have been a couple months ago, and to make sure they continue to do that. Let's turn the program over to our friends from HCA. We'll start with Central Florida Regional. If you guys want to turn on the mics and go for it.
Okay, are we on? Okay, good morning. Jason, I want to make sure I introduce Dr. Shawn Benoit. He is our Chief Medical Officer here. He's been here a little bit longer than me, 2 weeks longer than I have. And I would not be doing him any service if I did not ask him to join me here on this panel discussion. And early on, whether he thanks me or not, I made him the point person for all things COVID. And he has done a fantastic job with it. It has been his life, as it has been many of ours. So I wanted to make sure he was with us here today to share some of his learnings and findings. And you're probably going to hear much of the same from many of the hospital executives, because one of the things that we did early on, and I think it was the suggestion of Tim, if I'm not mistaken, was weekly the hospital CEOs and CMOs spoke. So we had a really good understanding of what each hospital was seeing, what their challenges were, and we were sharing best practices. So many of our phases are probably very, very similar. I think some of the early findings for CFR, and very similar to others, were administratively. We are accustomed to conducting meetings in person. We are not the most progressive when it comes to Zoom and other type functions. So it was a challenge, not so much for our administrative team, although somewhat, but our medical staff, who is not accustomed to using the mute button and various functions like that. So those were just some of the funny challenges that we still sort of face today. But really it was around uncertainty and the anxiety, and we could not communicate enough. One of the benefits that I tell people often of working for HCA is the size and scope and scale and the best practices that we learn. So although Seminole County and Central Florida, we were not hit as hard as some other markets, some of our markets were. San Jose was early on hit with a spike of COVID patients. They were about 2 weeks ahead of where we were. So HCA was able to share an incredible amount of knowledge, what they were going through, that the rest of their 180 plus hospitals could learn. So the communication for us was coming fast and furious, sometimes every hour from our division office or our corporate office. So we could not communicate enough with our staff, with our medical staff, whether it was face-to-face communication or via email. We were peppering communication like we had never seen before. And then the truly impressive thing for me, and I'm sure Dr. Benoit would say the same, was there was probably more anxiety administratively than there was from the clinicians. The clinicians, the nurses, the physicians, the techs, you name it, handled this incredibly. We never ran into an issue treating patients. We, like many of the other hospitals, set up cohort units for our COVID patients. So it was a restricted area where any patient that was either positive or potentially positive was placed into a unit. And we asked for volunteers from our nursing staff to work in that cohort unit. And administratively, we thought at times we would have a challenge, but there has not been one instance to date that a nurse has not stepped up and said, I will take care of that patient. This is what I do. I got this. And that was probably truly the most impressive thing that we saw from our staff. And once that took place, the rest of it was just a matter of taking care of the patients. And that's what they do each and every day. So we did, but I know we're not on the other end of this. We're into phase 1, which is coming back to elective surgeries, which we started on Monday, like everyone else in the room. And one of Shawn's points earlier, and we're seeing it here too, is there is a hesitation for patients to come back to the hospital. What we thought we were going to see has not yet transpired, and a lot of the feedback we're getting from the physician offices is at times they're having challenges convincing their patients to come to the hospital right now. And the fear is that when they're at their worst, they're going to seek care in the ER, and our acuity is going to be like, it's going to be higher than we've ever seen before. So we're trying to communicate as much as we can with the community, with the physician offices, that it's okay to come here. It's safe. It's a sterile environment in the OR. It's probably the safest place you can be when it's all said and done. And so there is this apprehension right now, and it's understandable, but we're going to do our best to ensure that patients are safe if they arrive here. So Dr. Benoit, if you want to add anything additional to that, I think now would be a great time, Jason.
Yes, and good morning, and thank you very much. I'd like to echo some of the things that Trey had said. We're very proud of our staff, the work that they had done in preparing and continue to prepare for any surges and any patients that would come in who are COVID positive or PUIs. They've done an amazing job, including taking care of one of our very sickest patients who we were able to give some convalescent plasma to. And that patient was on the ventilator, not doing well, but she left the hospital alive. And we're very happy about that. We've seen multiple cases at our institutions, but the numbers have been small. Many of you are familiar with the numbers here in the state of Florida. I think putting in perspective per 100,000 cases has always helped us think about this. So in New York, they have 1,600 cases per 100,000, but that number is only 177 in comparison in Florida. Similarly for deaths, when you might have 132 deaths per 100,000 people in New York, here in Florida, that 132 number is just 7. So that number is small, but for us, nevertheless, we're still paying attention to where we are. We pay attention to what's happening within Central Florida, just like the other institutions, looking at our PPE, making sure that people are prepared. And we're very proud of the staff who volunteered for the assignments to take care of our staff, and we continue to support them so that they feel supported. Thank you.
Excellent. Thank you both for that update. I was chuckling, Trey, when you were talking about the physicians adopting the new tech. I was in the business when we were trying to get them to go from paper charts over to electronic medical records. And I remember the challenge that was there and continues to be a challenge for those that went to medical school on paper records. So I can only imagine that overnight they're being asked to go to a totally new platform, what that could have been like. And the other thing was the opening of the hospitals for elective procedures. I think when most people think of elective procedures, they think of a cosmetic surgery, but really it's anything you can schedule. So people are putting off that hip replacement or putting off that knee replacement, and that could turn into a more serious event that ends them right back up in the ER in a worse place. So I think that's been huge. Casey, let's move over to you in the Oviedo Medical Center. How are things going over on that side of the county?
Going good. And can you guys hear me?
Yes, sir.
Good, good. So thanks for having me this morning. And, it's been quite an interesting 8 weeks and probably share some similar thoughts as to the other panelists, but maybe from the perspective of the new hospital on the block, a little bit smaller in size hospital. But let me tell you, the first thing that came to mind when invited to speak to this group was a similar message. And it's what I worry about today are exactly that population of patients that we know are not coming to our emergency room, that we know need that care. And I can tell you, as far as PPE and all these other things that we talk about, right now, that's probably one of our biggest concerns. And I say that for our hospital in particular, because we have seen some COVID, but we've also already started to see examples of that. And without getting into any patient privacy issues, I can tell you we had a patient with a bad outcome over the last couple of weeks who had quarantined himself and didn't go regularly get some pretty critical medical treatment, missed at least 2 or 3 sessions of it. And by the time he had arrived at the hospital, was in, really bad shape, also symptomatic for COVID. But we know, based on our volume, based on the things the doctors were saying earlier, that folks that need to be coming and receiving care. And that's what we do, right? We don't like being shuttered. We're doing what we have to do today, but we are here for a reason, and we just have a lot of concern. So I want to talk just quickly about, where, kind of like Shawn did, where we started, what we experienced, and what we're seeing now. I think, as with everybody, a lot of prep work went into this. We followed that same model out of Washington, that was really tracked nationally. So gosh, about the second week of March, we were expecting 200 to 250% capacity. We've got 10 ICU beds, 10 ventilators. We had prepped to go up to 26. We built out our MOB, that's our medical office building, to take another 50 to 60, probably suspect patients, or even convert to a COVID ward. Over a time period of the next 3 to 4 weeks, obviously everything changed. And we shifted more into, focusing on how we are going to continue going forward. But what we experienced during that time, I think similar to what the other folks said, was a culture, a medical staff. And I don't know if you guys can see the picture behind me on the wall there, but that is actually the 2 beams of light up in New York City from the Twin Towers. I was there that day, and I don't want to try to compare those 2 events, but what I do compare, and what I'm reminded of over these last 4 weeks, was the passion, the commitment, of those first responders. In New York, it was more our firefighters, that were on those front lines, but a ton of first responders, and the way they were able to put their fear aside and do what we needed to do to serve our community. And I can tell you, in Oviedo, I saw that firsthand, whether it was our doctors meeting every day, talking about the latest coming out of Italy or New York, everything from proning patients to the new drugs that you hear talked about, to the convalescent plasma, all those things that that we're in an environment that we're moving faster, I think, than we ever have or been allowed to in the past with those options. I think the community support, when we saw how our community came out and supported us through this, a lot of food, obviously, and we appreciated it, but we really just appreciate the recognition. We've got a big event Saturday. A lot of the local churches are coming out, and I think it's some kind of prayer event. We're not involved in scheduling it, but the community has taken that on. Our first responders have been out, and I can tell you the staff just appreciates that so much, even as much as the food and those sorts of things. And then when you talk about COVID at Oviedo, obviously nothing like I talked about earlier that we were projecting. We're averaging anywhere from 2 to 5 PUIs. I think right now and obviously PUIs, I think was described earlier, but those are patients that present symptomatic, that get in, we test and treat as if they are infected. But even over the last week, I think we have 1 in our ICU, and that patient has tested negative probably the last few times because she's been with us for that length of time. The other interesting thing that we've seen is an increase actually in volume in our babies. And I think that has to do with just the way Oviedo is set up. We are a very concierge type hospital. So big rooms, private areas, a lot of access control when it comes to moms and babies. But we actually delivered about 15 to 20% more babies last month due to folks wanting to come to, I think, the smaller private type hospital environment for that service, which I was not expecting. And then I just think now, obviously, we talked about getting back into elective surgery. So, similar thing with Oviedo when you talk about private pre-op, private post-op, how we're able to offer that in a completely separate environment than potential COVID patients. But also just all the things that we're doing, we've really kind of decided on 4 major areas to focus, first off being access control, all those things. Everybody's doing screening, everybody that comes in the building, cohorting patients, all those sorts of things. Second being distancing, when you talk about how we serve our food in the cafeteria, as Trey was mentioning about meetings, but also around that patient cohorting, keeping doors locked. I don't know if everybody knows, but we actually go above and beyond, and that goes for all the hospitals, I think, when we're looking at COVID, using negative pressure rooms, above and beyond on the PPE. We've not had an issue in the state really with PPE usage among the HCA facilities. And then lastly, I think infection prevention. When you think about everything that all businesses are doing, hospitals are doing it even more so, in terms of high touch areas, but also just looking at protocols and putting policies in place to impact that. Visitor thing is something that I really struggled with. We are at no visitors in most hospitals right now, but we know in healthcare that having an advocate as a visitor, we try to put ourselves in the patient's shoes, is sometimes not just a nice thing to have, but a necessary thing when those patients are confused and or just under the amount of stress that you're under in a hospital. So we constantly look at that and make sure that folks have advocates. But obviously we're using FaceTime and other technologies and ways that we really never imagined getting into this. So a lot going on, but I think a lot of good stories for our hospital and how we've weathered it and what we have going forward.
Well, that's great to hear, Casey. I really appreciate that. And If you all caught what Dr. Benoit said about our cases per 100,000, our community has experienced less than 1/10 of what we're seeing in other parts of the country. And so hats off to the team that's been making sure that we're doing that, and hats off to our community for really bending that curve in a meaningful way, and making sure that we're not overwhelming our hospital providers there. To round us out, let's go to our friends at Altamonte. And so Tim and Dr. Sinclair, if you guys unmute yourself, you all are on for an update.
Good morning, everybody. Well, in the essence of trying to summarize, I think so many things have been hit on that are cumulative in terms of how we're all facing this. I do want to echo, though, a great deal of gratitude to our community leadership. I don't know that we'll ever be able to prove how much of the social distancing and the stance our community leaders took to pull back on various aspects of our community. I don't know if we'll be able to prove with data that lowered the curve, but I do believe it did. And I think we saw a shift, and I think we can be very, very grateful for that leadership stance that was taken. And as my colleague said, we kept in contact, and it was Casey who actually initiated that. I just became the traffic control guy, but it was very important for us to stay connected. And it was something that we could see that we were in lockstep as we went through. I also want to echo gratitude to just the general community. As Casey said, man, we were fed well. We've been fed well. We've been prayed over, and we've had our horns honked and lights flashed and sirens. And as Casey said, that feeds the soul and the hearts of the people who are on the front lines. And to see our own staff actually standing out front, emotional, just seeing a fire truck go by, that kind of puts it in perspective. So it's been quite an interesting phenomena. Not surprisingly, people who are geared to run towards the fire are not really as much afraid about the fire, dealing with the patients, as they were. The fear that expressed itself was the fear on the part of the staff of what if they get this and take it home to their families. And so that became a kind of a precautionary process that we really wanted to work with our team with PPE and all those things you heard about to try to make sure that we had the environment safe. So we've talked a little bit about that journey, and it was an interesting one. It's probably not over. COVID will be with us for quite some time. Going forward now, as my colleagues mentioned, there is still a great deal of fear, and the intellectual knowledge that you might be safe is one thing, but the feeling, the emotional sense of being safe is another. And as we move forward into reopening, like my colleagues, we have implemented several things that you will see become much more normative in hospitals across our country. Sitting next to me is Dr. Sinclair. You will see him handsomely donning a mask. When you come to the hospital now, all of our hospitals, you'll be asked to wear a mask. Patients, staff, visitors, it will be the common visual. And it's very important both for the psychological safety, but as well as the reduction and diminishing the transmission of droplets that might cause that. As everybody is doing screenings, you'll be temperature screened. These will be more and more normative. Testing has become a big part of where we're going and what we believe is safe. And frankly, testing, if you hear the news, it's a quagmire of challenges. We don't have the robust infrastructure that we need to keep up with it. But we have committed that every patient that comes in the hospital, every patient that's going to surgery will be tested. And we won't do surgery, even we will do it on an emergent, but on elective patient, we will not do surgery on a positive patient because we found out that the outcomes just aren't good scientifically. Cohorting, as some others mentioned, you will see when you walk into all of our hospitals, new signs, keeping people distance, the way you sit. All those things are important to reinforce that this is a safe environment. What you'll also see is a lot of people just wiping down everything all the time. And, you know, the idea of catching COVID in the hospital is probably the last place you're going to catch it. As we open up different public venues, those places are going to be safe if we stay distant. But in the hospital, man, we've got a harp that plays over the overhead every 4 hours. And when that harp plays, everyone stops and wipes down their area. So it's just these cues to try to keep people focused on safety. I'm going to let Dr. Sinclair talk a little bit about actually the virus itself and kind of how it's connected to SARS and some other things historically we've been aware of. And that kind of tees up, I guess, the discussion about where we're going and how we beat this thing going forward.
Thank you, Tim. I think I'd just like to leverage or pick up on something that Tim mentioned as we continue to take the temperature as well as to test all of our healthcare workers and providers. We at AdventHealth have taken the initiative to ensure that all of our medical staff are also tested prior to performing surgery, prior to performing any procedures, or actually entering the hospital. So I will lower my mask because I actually had a negative test 2 days ago, just so that you can see.
Thank you.
You're welcome. We're grateful. I'm very grateful for the stance that AdventHealth has taken. And I know Dr. Sanchez talked about the way that we've looked at protocols and care management plans for our COVID patients on our units. We continue here to have a scientific community, a scientific committee that reviews publications, evidence, case reports as it comes forward, so that even as we look at that post-pandemic period, we continue to monitor very closely any new information so that we provide a safe environment for our patients, as well as not only those that are here for elective procedures or admissions, but also ongoing care of our COVID patients. We continue to have our COVID unit within the hospital, as well as cohorting in the ICU and the emergency room. And I think this is an important message to convey to the community that we continue to take these important measures, even as we're looking to open our door to elective procedures. You know, we've been down this route before, dealing with COVID-like viruses, SARS, a COVID virus, MERS. We've tackled those back in early 2000. We haven't heard about those viruses of late. And even though we're looking at a very contagious virus now, even in comparison to influenza, I think it's important for our community to know that we have taken here at AdventHealth Altamonte those strong steps of temperature monitoring all of our visitors, all of our healthcare workers, providing a surgical mask to all visitors who enter, as well as our healthcare workers, ensuring that all of our physicians and our providers have been tested as well, and even all of our inpatients, as Tim mentioned, within the hospital being tested, so we know everyone's status and we can take the appropriate steps. We continue also to have great communication throughout our division, all of the CMOs, all of the CNOs, our chief operating officers talking on a daily basis, so that we remain together and that we have a standard approach as you enter our hospitals. So with that, actually, Tim, I'll turn it back over to the panel.
Thank you guys very much for the update on that. One of the things that we'll do now is we'll kind of get into some questions that we've heard. It's been fantastic to see the medical community coming together. It's another great reason to be in Seminole County. And we'll go through each team to have a chance to answer the individual questions. If your team has something in particular you'd like to touch on that a different hospital was asked, please feel free to do that. And we'll kind of go around the horn, but we'll stay with Tim and Dr. Sinclair for the first one, because Tim, you mentioned it in the beginning, which is the mental health and counseling for the staff itself. How is that being handled, and how is their emotional health being dealt with as we go through this?
Well, it's been a big issue for us, and we have several resources right here in-house at Altamonte. We have a mental health professional who's been stationed just in a room and is available by phone 24 hours a day, as well as a ERP type service. We've had our chaplains rounding. Being faith-based gives us a little bit of an opportunity to be very, very open about this and work with people to support them on a spiritual, emotional, and psychological level. So we've had as a system a great deal of resources that we continue to provide, even with our physicians. Their support groups, they meet on a regular basis talking about this. We have a whole division within AdventHealth here to support the physicians with psychologists and so forth that they've been able to tap into. And not surprisingly, people have utilized those resources because they have seen and experienced fear and anxiety that they want to talk about. So it has been a big part of the process.
That's great. Thank you very much. We'll shift over to our friends at South Seminole and our infectious disease specialist, Dr. Sanchez. With the additional measures being taken to prevent the spread of COVID-19, are you noticing the decrease in the spread of other infectious diseases, viruses, staph infection, flu? Is this helping stem other things that you would have normally seen?
Well, it's difficult to say with the flu because we're not in influenza season right now. As the weather warms up, we expect a decrease in other viruses anyway. As far as other different kinds of infections, I have not seen a decrease in things like MRSA or those kinds of infections. I see the same rate, but I do see a decrease in patient load as an entirety, and I think that goes to what I was telling you before, that people are afraid to come to the hospital. So when I do see people with infected wounds and such, it is a much higher level of acuity, and most of the time, and many of the times, the patients have waited way too long to come to seek care.
Yep. Very good. Thank you for that answer. Interesting as we go through this to figure out how this is working relating to others. Trey and Dr. Benoit, we had spoken a little bit about the cost of the temporary suspension of elective procedures. Do you think that that's going to drive up costs or ultimately lead to an increase in the cost of healthcare as folks who had put off elective procedures now are flooding back in?
Potentially. I think it's too early to say whether that's going to be a long-term solution for patients sitting it out and not coming to receive their care. I certainly think if the phase-in approach works, and we shall see if that is the case, it's something that we certainly support. We should see an increase and a rise and a comfort level in seeking care. We've certainly had our challenges during this time. We have been running around 50% capacity. So we have 2 nursing units that have been shut down for over a month now. Fortunately, for us, in the way we've set up our systems, we've been able to redeploy that staff to other areas. So to date, we've avoided furloughs, we've avoided layoffs. We have been able to use our staff in other areas, whether it's in another nursing unit or taking temps. As you heard earlier, we have 2 entry points to the hospital currently, and we have staff there 24/7 to take your temp when you enter, as you grab your hand sanitizer and a mask. And so fortunately, we've been able to repurpose our staff, and that has gone a long way with CFR, and I'm sure many of the others as well.
And as a follow-up with that, when those are having elective surgery and procedures, how is visitation from friends and family going to be handled?
I would anticipate us slowly easing back to where we once were. We're probably getting closer to allowing 1 visitor per patient as we allow elective surgeries to continue. Like many of the others, we went to no visitation with some exceptions, deliveries, end-of-life pediatric situations such as those. But I would think you're going to see hospitals attempt to go back to the way it used to be, if that's a thing. In terms of the new normal, but we're getting closer to allowing 1 visitor per patient during this time of elective surgery. But I will tell you, one of the findings we've had, and I think some of the hospitals will tell you the same thing, during this time of COVID, we have seen our patient experience scores skyrocket. And I'm not sure it's pity on us having to be here or gratitude. Some of the nurses will tell you it's because of having no visitors in the hospital. I don't know if that's really the truth, but it's been interesting to see our patient experience scores increase during this time. And many of the nurses will tell me daily that we should stick to the no visitor policy. It helps our patient experience.
Interesting insight. Casey, we'll shift over to you. Trey had mentioned in his comments about the benefits of having a national network like HCA in so many hospitals. What is the process and the procedure you all have for your personal protective equipment? Is it reused? How much do you have? In the beginning, we heard about concerns about not everyone having enough, which was the impetus for decreasing elective surgery so that we made sure we had enough PPEs. What's the procedure like, and do you anticipate this being masks and disinfecting being the new norm? How long do you think it's going to go, and do we have enough supply?
Yeah, so being with the big network of hospitals of HCA has always been a nice benefit to have. But I'll tell you, it's more interesting, I think, in this environment than we've seen in prior national disaster type environments, say like a Katrina or a hurricane, where then we swoop in with all the national support into one region. Here, we've had to spread that, obviously, as we didn't know exactly where the hot spots were gonna pop up. But overall, our approach has been very much daily, even hourly management. I can tell you PP&E has never been an issue for any of the hospitals in Orlando. I get an inventory report every day. We have looked at all those recycling programs. We even have the bags where we're saving some of the old masks because that was the responsible thing to do. But we have never gotten close to the point of using a recycled mask or needing to go that route. And it took a little adjusting to in the beginning because folks are used to being able to pull that mask off the wall or out of the supply room or wherever. And now we've got one person on a cart literally taking inventory probably 2 to 3 times a day that we could tell you exactly how many masks we have in-house. In terms of where that goes going forward, yeah, that's a tough one for me. I'm the only one sitting here without a clinician sitting next to me, and that's a clinician type question too, I think. But what I can tell you, my perspective on that is, as long as we're getting that advice from our clinicians, we're going to stay ahead of everything we can in terms of all those concerns that the public may have about coming into a hospital. I can tell you we're going to go above and beyond, and I don't see a short-term time that we're going to be taking the masks off. But I can tell you on the elective surgery piece, a couple comments on that. One, I think the financial impact is something people don't understand, especially for a hospital like ours, where we do a lot of elective surgery, a lot of outpatient surgery. We are, if we weren't part of a big system like HCA, we would not be able to fund our day-to-day operations right now. Now, because we are, we have those opportunities, and our employees are really being treated, I think, as well as anybody in the industry. So, that's kind of the thoughts on PPE. And on the elective surgery, I'll tell you, just to follow up on what Trey said, we have started doing that, and we are allowing an advocate. And I'll tell you, that is a discussion between the surgeon, family circumstances. But, we're going to err on the side of safety first. But safety also includes having an advocate that can help you guide through that process, that can listen to what the doctors are saying post-surgery, and then, realistically give you a ride home and all the things that need to happen. So a lot going on with surgery right now.
Excellent. Thank you, Casey. We'll shift back over to Dr. Sanchez. We have another infectious disease question here. A lot of the national labs are selling immunoglobulin tests for diagnostic to local employers. What's the value of one of those IgG tests, and can you comment on what it would mean to know that for employers and employees? Is there a proper way to do one? Is there a better test that we should be looking for? What do we need to know as employers and folks that are going to re-enter, particularly those that are looking down the barrel of school opening back up in August? How long and how many tests in that arena do we need?
Sure. So antibody testing or serology testing is a test where they check your blood to see if you have had immunity, antibodies to this virus, which would mean that you would have picked up this virus at some point. So what they would do is check the amount of antibodies, IgMs and IgGs in your blood, and if you were positive for this would imply that you had this virus. The second step would be to check whether you have the virus currently, or you've already had it and it's already been passed. A couple caveats with this. One, there are a multitude of antibody tests out there, all directed against different parts of the virus. Some are better than others. Really hard to say in a very short time which of those tests are the best and which ones aren't. Many places are wading through that right now, including our institution. And the second part of these antibody tests is, while we in this infectious disease community do think that it will confer some kind of immunity, we don't exactly know how long that immunity is and how much immunity that will be. Meaning, for other coronaviruses, usually and a year, 3 for SARS, for the original SARS, for example. But even those years on, after those 1 or 2 people, other coronaviruses in the past, if they were to get it again, we know that second illness, the second time they have it, is not as strong as the first one. This virus has only been around for 4 months. We don't know where in that spectrum it will lie, meaning we don't know if you have antibodies to this virus. One, how long will you be immune to it, and how much, and will it be total immunity, or will it just allow you to have a lesser response if you were to get it a second?
And so a follow-up to that question might be, what are your thoughts on maybe a second wave coming of this in the fall sometime?
Until we have a vaccine, until we have a vaccine or herd immunity, which I hope we don't have to reach, because that would imply 60 to 70% of the population gets infected. There will be ups and downs as far as the amount of people that get this virus, and so a peak or a second wave implies that it would be just as strong as the first one. We're hoping that's not the case, and with the policies that we know that we've implemented in society and our hospitals, from what we learned from the first wave, but we're hoping whatever that second peak is nowhere near as big as the first.
And so just to put a cap on this, then you believe social distancing will stay in place for a while until either a vaccine, or that's about how long we're going to need to do it?
Yes, some sort of mitigation factor. Okay,
great. Thank you very much for that. Last question, as we're getting close to the end here, we'll go to Dr. Sinclair and our folks over at Advent. How have you all been communicating with other state and federal partners, interacting with the Department of Health? You're using different kinds of IT solutions. What is the process by which you all have been kind of communicating with your other healthcare partners to report data, that sort of thing?
Well, let me start with locally. I think all of us are reporting to the Department of Health in Seminole County our daily admission rate and census for COVID, because what we're trying to do in Seminole is trying to monitor in some way, are we picking back up? Are we staying flat? AdventHealth as a company, of course, has hospitals similar to HCA in lots of different states. So through our system, we're connected at the state and the federal level through that coalition. So we have a lot of intercommunication, and I may not be getting at what you're going for, Jason.
Okay, yeah, I think that's probably going to be sufficient for us just to make sure. I think the question was more around making sure that working with the Department of Health, and so the numbers we're seeing on the news you all are being represented and recognized by the numbers that we're seeing overall, and that's great.
Yeah, I think in Seminole County, we're in really good shape because the coordination there is very tight, and we are presenting numbers daily of how many patients we have. So Dr. Husty and Donna Walsh and the team there are really monitoring it very closely.
Well, I think we got to almost all questions except for the last one that just came in, and maybe this is a Dr. Sinclair question, is what are your thoughts on the creation of this becoming a superbug due to overuse of antibiotics? We all know about resistance levels of other antibiotics. I know this is a virus, but do you have any concern at this point about the creation of a superbug?
I don't have any particular concern. This obviously, as you mentioned, is a virus, very different, not treated with antibiotics per se. I don't know if Dr. Sanchez has any further light to shed on that, but that would be my response.
Dr. Sanchez?
Sure. So I am not concerned that this virus will create a superbug, because as Dr. Sinclair said, is we don't use antibiotics typically for this. But I do want to reiterate that we're always concerned about over antibiotic use in general and creation of superbugs, regardless of COVID or not.
Perfect. Well, that's going to wrap it up for today. I want to thank everybody who was on our panels. Orlando Health, thank you, Shawn Molsberger and Dr. Sanchez. From our HCA friends, thank you, Dr. Benoit. Thank you, Trey. Thank you, Casey from Oviedo Medical Center. And from Advent, thank you, Tim and Dr. Sinclair. This has been wonderful. I know you all have super busy schedules, and so we really, really appreciate you being there. If you're not a member yet, please reach out to Christy O'Leary. We're going to put her email in the chat box as you all can see those things go. Be sure to follow our chamber calendar for other upcoming virtual events, and we're going to add that link to the chat as well. And tomorrow we have Fitness Friday with SoFlo Hot Yoga. Tomorrow morning at 8 a.m., we have a Zoom update on COVID-19's economic impact to the region. Tomorrow at 9 a.m., just like this, and a lot of great ones you can join next week. Also, show your chamber pride by ordering your Stronger Together Tapestry t-shirt and support the chamber for just $20. You can support the Foundation for Seminole County Public Schools and the Foundation for Seminole State College, recognizing the value of our education foundations here in Seminole County and you supporting your community as a whole. You're going to find more information. You see Rebecca posting those links in the chat. Thank you to Mid-Florida Credit Union, Next Horizon, Waste Pro, the Orlando Law Group, and Highland for sponsoring this great event. Have a great Seminole County day. We'll leave the chat open for a little bit so you can get those links. And if you have any questions, please feel free to email us or check out our website at seminolebusiness.org. Thank you all. Have a great Seminole County day, and we will see you all in person soon at a distance. Thank you all for coming.